relieve cubital tunnel syndrome now. What is cubital tunnel syndrome? Well, the cubital tunnel is a little tunnel where we sometimes hit the inside of our elbow, which we call the funny bone. It's actually not a bone, it's a nerve called the ulnar nerve. The tunnel is made up of this inner bony prominence of the inner edge of the humerus bone called medial epicondyle. Back here's a bone called the ulna, and it has what's known as the olecranon. Then there's a fibrous sheath called the cubital tunnel retinaculum, whereas this ulnar nerve comes down from the inner head of the triceps and by the triceps tendon goes right through this little space called cubital tunnel. Cubital tunnel syndrome is the second most common nerve compression of the whole upper body, second to only carpal tunnel syndrome, which involves the median nerve. See our future videos on it. Today we're going to focus around this inner elbow and how to relieve these symptoms both in the short term as well as in the long term. What would be a common human movement diagnosis that causes cubital tunnel syndrome? We can have repetitive elbow flexion syndrome or sustained with compression of the inner elbow syndrome. Either of these two movements done repetitiously can indeed affect the ulnar nerve in the cubital tunnel. What are your signs and symptoms? Oftentimes symptoms start first. It could be an inner elbow aching pain. It can eventually lead to radiating symptoms down the inner part of the forearm or the ulnar side of the forearm. As symptoms progress, you can get numbness and tingling into your fifth digit and the inner half of your fourth digit, or the ulnar side of the fourth digit. If the symptoms are ignored at this point and the compression neuropathy progresses, we can actually get wasting of the muscles within the hand, particularly the deep intrinsic muscles of the hand. In severe cases, you can get claw hand. So we want to prevent or avoid this condition from ever getting that close. So step one for short-term pain relief is to identify the movements or the repetitive movements that's causing the symptoms. So if I'm doing excessive repetitive flexion during workouts, I need to rest from that activity until the symptoms start to improve or go away. Second, maybe I'm somebody that sits with my elbow on my desk or my armrest or my car seat console and it's compressing it. We want to take that offending movement away for instantaneous relief. Next is how we sleep at night. Many people will sleep with sustained elbow flexion. In fact, this is one of the tests, elbow flexion test and or elbow flexion with compression test. If this reproduces your symptoms down into your fifth digit or your small finger and or the inner part of your ring finger, you now know you've got a cubital tunnel problem. Thus, we would want to sleep with our elbows in extension to keep that tunnel open. This would all be short-term, immediate symptomatic relief of cubital tunnel syndrome. However, long-term requires both the ergonomic changes and the positional changes along with good mobility of the musculature where the nerve runs. So if I have any restrictions on my inner triceps, and as I do this, I can feel symptoms go down to my fourth and fifth digit. Being a person that does a lot of push-ups, a lot of planks, working on patients all day, I use my triceps all day. Thus, I need to mobilize the triceps and where the ulnar nerve lives to free it up. I'm also working this mostly in extension and some flexion for anywhere of a starting dose of 3 to 5 minutes. Next, I'm going right on the retinaculum, the fibrous sheath that makes the roof of the tunnel where the ulnar nerve lives. I'm doing gentle cross fiber up and down mobilizations with different forearm and elbow positions, and especially with the elbow in extension. Then the nerve comes through a muscle on the inner side of the forearm called flexor carpi ulnaris. It pulls the wrist in and up towards you. So ulnar deviation and flexion, I can find that muscle. So here I'm mobilizing flexor carpi ulnaris. Starting dose 2 to 5 minutes. I can stroke with muscle. I can go cross muscle. We can also do contract with mobilization and relax as we go out and away. So up and in, out and away. Last site of compression for ulnar nerve is Guion tunnel, which we will cover in a separate video. Last are ulnar nerve glides. We do not recommend you start smoking, particularly cigarettes, for they're one of the worst things for your overall health. But imagine holding a cigarette or something upside down and gliding the ulnar nerve. I can do it from where the nerve starts in the armpit as it runs down along the triceps, and as it comes down on the inner side of the forearm and into the wrist. Initial starting dose is 20 to 30 repetitions, 2 to 3 sets. Next are called the halo mobilizations. Here we pinch our index finger and thumb together, open up the hand, really spreading out the 4th and 5th digit called abduction, and we draw a circle over our head. This can be called the halo or Yahoo ulnar nerve mobilization. Do 20 to 30 times clockwise, 20 to 30 times counterclockwise, with the starting dose of 2 to 3 sets twice a day. As always, we want to avoid the offending movements that's causing the pain. This can give people drastic relief and or resolve the symptom to help prevent surgery. Surgery requires moving or opening up or releasing where the nerve lives. Remember, you can always be cut on, but you can't be cut off. This is Dr. J with the Human Movement Institute, where we have improvement through movement.